Oh, so today is, another beautiful, beautiful, beautiful day. I'm like so pumped and excited to get on with the third episode. Yeah, third episode. What? We've done so much. Or so many. Oh, yeah. This third one. I feel like I'm ranting. Scrap. So, with me on today's show, Let's Talk Public Health show, we have Dr Temidayo. Personally, this man, he's a big man. I admire him. So I'm begging him. I said, sir, please cut soap for me. Even
Narrator.
any size, how we love it.
Narrator. Oh,
Please,
God.
sir. Sir, please, I'm on my knees.
Chineke.
I'm begging you to cut soap for me.
Narrator, you have to bring
Wait,
this on
wait.
here too.
I need the audience to understand that I'm begging you to cut soap for me because you are the country
Oh,
growth
oh
manager
boy. Oh,
for
boy.
medics
Oh,
to
boy.
you. International. This is a UK company.
Oh,
Oh,
boy.
God. See how Dr. Temidayo just acting humble. So please come
Loretta,
out.
you look my supper self finish. You choose to go. To hit my jugular. Really?
No.
Ah.
I'm not saying anything.
We
We
are
have to-
friends, though.
We have to be honest.
We are
on this
friends.
show. We have to
Ah.
be honest.
That what we can't mention. We can't be like, say they announce a special advisor to the president. Too much now.
Hey, God.
It is well.
I can't let
It is
the
well.
world not know about how amazing you are.
Oh wow!
Really?
Oh, wow. Oh, wow.
Really?
I'm blushing.
Oh,
Jesus
God. Oh,
Christ.
God. I love
Somebody
it.
carry me away.
So, sir, please start by telling us the work
Okay.
that you do.
Thank you very much, Loretta.
Yeah.
You're awesome. Honestly, you're awesome. Thank you. Thanks for having me. And wow. That introduction, not for me, wasn't for me, Biko, because I'm just this. Yeah, I'm the country group manager for Medics to You.
Yeah.
And what we do there is similar to what Helium Health has been doing. We're trying to create a disruption, just as Helium Health is doing. We have we have a telehealth platform, which ranked in the top 20, in the top global 20 in the year 2020,
Interesting.
as a platform for having teleconsultations amidst people. So we want to help payers, we want to help patients and care providers bridge the gap in convenience, the gap in access to quality healthcare. That's all just what we're doing. And this has been in use in the UK about 2018. So we came into Nigeria about around last year. Wanted to let everyone have the advantage of quality care.
Oh, yeah.
When ease and access is made even more convenient. When ease is made even more better than it used to be.
I love it, to be honest. Because, no, this is for real. This is the time where we need a lot of health tech innovations.
Yes.
Not to shade, but I really, really, really look at fintechs and I eye them because you people are shouting finance, money. If I don't have the money, how will I use people's products? But health is much more important.
Yes.
Because people are dying on a daily for cases that could be prevented,
True.
And the pandemic has made this a reality to us. It's brought out how much of a big deal health is. And I'd like to know that what steps have you taken, let's say personally, and even in you or in your role as the country group manager, to effectively tackle,
the pandemic,
yes,
the COVID-19 pandemic.
Yes.
Thanks for that question. You're right. You said it there that health is like the front burner, and it's something that a lot of us were kind of oblivious to, but COVID-19 sort of made it more prominent and made it something we had to be aware of by fire, by force. Yes, that health itself is wealth. Whatever we may be chasing, whatever our prospects are, whatever career we may be going after, that we must make our health number one priority.
Exactly.
Yeah, that's one benefit that COVID gives to us. And yes, since COVID has started, what have I been doing? Personally, I had to protect myself. Yes. Yeah, I had to do that. Yeah, I had to do that. I had to protect my family. And I had to protect everyone around me as well. And so I've been a part of, I've been doing advocacies, volunteering, right? I've also been part of joining people who had been conversing for others to either maybe get face masks or get vaccinated and all the likes. And in Medics to You, right, and it's beautiful because in Medics to You, the solution we're providing is to make sure is to provide some kind of caution to mitigate the effects that COVID itself is playing out in our public spaces. So we have provided this solution, right, to make sure that there's ease and there's convenience in patients being able to access their care providers.
Awesome.
So we're coming in at a kind of critical period in time where COVID is disrupting everything, providing the solution to make sure that, you don't feel too much of the effects of COVID.
Yeah.
You don't get your health dampened, or you don't get your optimism dampened by what COVID is causing out there. So that's what we're doing greatly at Medics to You. And I think also one of the things we're able to do is just keep talking about COVID. Keep bringing awareness to on the issues of COVID. Keep telling people what to do. You go on the app, on the Medics to You app right now. You find a place there where you get insights or where you get more info on COVID itself. So there are a lot of things we're doing. There are a lot of things I'm trying to do personally. I've not done all of them anyway because
you can't do everything. So that's fine.
Yeah.
So that's fine. So I don't want you to throw a shade, but I was thinking. At first, it's easy for people to say, oh my God, healthcare in Nigeria is horrible. I'm not trying to say healthcare in Nigeria is great. But this pandemic, it really showed that different healthcare systems were not equipped. Maybe, I don't know. But so far, so good, right? Have you looked at, public health systems, and what do you think about it? Are they with this COVID that we've had, right? Do you think that we'll be able to, in future, let's say, prevent future outbreaks? If not, what are the things we should start to put in place, especially for public health, all of that?
It's that question, though. I think we'll be able to take the lessons from here and prevent future outbreaks. I want to say no, right? But I'll probably want to tone it down and tone down that the gravity of that answer into something that sounds like, well, maybe I think we've learned some lessons, right? I think we maybe in a way will better respond to whatever may still come after this. I mean, after COVID, after this third wave of COVID, we've learned some lessons that may make us better prepared for whatever is still coming. But if we are really, really prepared to handle anything, that question, I think I'll just leave it for later, really, honestly, because I really can't say. I mean, when COVID started, okay, let's go back to Ebola that happened few years back.
Yeah. I
mean, God bless the soul of Dr. Stella Adadevo and those healthcare workers at First Consultants who were the first responders and who helped us. Let me put it that way. Who helped the generality of Nigerians in containing Ebola at that entry point from that first index case. And then we were all happy. We were all in euphoria that we were able to contain the Ebola virus, and that we didn't expose ourselves to the casualties that would have occurred in the most populous black country on the earth. Then 2020 came, and then COVID entered. And it was as if we didn't learn anything from the Ebola situation. And now we are here. Cases are still rising. About 177 persons already with COVID. We are doing testings of about 2,500 a day, when a country like South Africa is doing testings of about, I think, 2.5 million a day. And it's like it's like we didn't learn anything from that scenario with Ebola, and now COVID is here. And even till today, I mean, look at how much vaccinations has been done in this country. Look at how many people are vaccinated. Look at going to our public. I mean, when an urban center here in Lagos, and go into an urban center like here and see how many people are wearing face masks, how many people are observing social distancing protocols. Go to our rural settlements. Oh God, that's even worse. See how many people are observing.
You won't believe that one day I was wearing a nose mask.
Okay.
And I passed by Ikoyi, but not the fine Ikoyi.
Okay.
What's the name of this place? I can't remember. Obalende.
Okay,
no,
yeah.
It's not Obalende actually. The place that now leads to Marina Apapa. I can't remember
okay.
now. But it looks like a tush. It looks like Ikoyi that was fine before.
Upscale, yeah.
But now we have now.
Watered down. We understand.
They watered down.
Osapa London.
And I was passing by. I was in an Uber, obviously.
Tush girl. Is she
not tush
baddest?
now. My mates are driving, though. You people.
No, Allah.
And people outside were calling me Corona because
Oh my
I had a
God.
nose
Can you
mask on.
imagine?
I was so upset. I was like, what is going on in this country? Like, so I get that side.
Yeah, it really behoves on us as a people, really. Because when we think about it again, when we say the lessons learned, how prepared are we? It's not just governments. It's not just the care providers. It's not just it's everybody. What lessons did we learn from Ebola? What lessons have we all learned from COVID? And if we've learned anything at all, that's in code. If we've learned anything at all, are we putting those lessons into use in preventing further progression of the COVID-19 pandemic?
So now, my next question would be, for one, because I work in a health tech organization.
Kudos to you. Congrats. Chop no.
Yes.
We're together.
I need it.
Of course.
I'd like to say that I know I've seen how big, technology has helped.
Yes.
So what things should we further adopt now? Not just in hospitals or at like a public health level to, let's say, beef up our surveillance, because I feel like if at some certain critical points proper checks, like I don't know if you've heard the story of what's the name of this, I can't remember the country right now, but it's an Asian country. This guy's literally held down, I think it's Taiwan. Okay. They held down COVID for like a period of time, but I mean, again, there'll be
you're correct about Taiwan.
Yes, there'll be problems in the system. We see Israel, they were leading the vaccine
efforts.
Do you understand? Yeah. So in Nigeria, how can we, I'm sorry, but looking at the NCD portal annoys me, because I'm just like, and we're proud to say this in public.
It'll have been convenient if we could look at Nigeria as if we're not in this world. Honestly, if we don't have to compare ourselves with other people, we'll probably be fine. Like, okay, we're doing great, or we're looking fine, and God is on our side. But when we actually now have to compare ourselves,
I see that as a shade. You didn't have to put that aside.
But we look at ourselves with other countries of the world, and then truth comes to the core, and then it hits at the bone. Right. We've not been doing great. But yes, technology has a very, very, in fact, technology, a lot of times I think about it like at the National Award ceremony in December or whenever it's going to be held. Tech people should be the ones getting the GCFR or GCON, and we are the heroes now.
Honestly,
we're the heroes, especially those of us in healthcare. I would clap right now for Helium Health. I would clap for every person in health tech at this point in time, because we have really... We probably were not known before COVID happened, but then with COVID we all stepped up. We've been the heroes, the one wearing the cape, using technology to bolster our healthcare systems, ensuring that COVID-19 doesn't just take us for slaughter as we're presenting ourselves.
Gosh.
And technology still has a great deal of role to play. Number one, technology helping us to predict the virus. Secondly, helping us to be able to detect the virus very early, detect its patterns of spread, detect how easily it gets transmitted. And thirdly, helping us to respond effectively to the virus so we can mitigate whatever dangers or whatever morbidity or mortality would happen from it. There is this application called Track Together, I think, in Singapore being utilized, where if you are positive from the COVID-19, you have a test result that is positive.
Yeah.
The mobile app, gets the results and puts on your Bluetooth and any other devices that are surrounding you or that are around you. Your own phone would alert those other phones via Bluetooth that the carrier is positive, and helps them to please 1 meter away, still 1 meter away, that kind of a thing, right? That's one area where
beautiful.
Yes, where digital technology is helping to kind of predict the spread of the virus. From you coming into the country, we can use technology to do contact tracing, so we know okay, this person left the airport and went to this particular area. So we can be able to now put that data to use and predict for certainty that this particular virus, if it were to spread at all within this particular period in time,
within this location.
Exactly. So that's what technology is going to help us to do, to predict exactly what the virus. So the virus is no more a ghost. It's not more a ghost that it's coming. No, we don't know where it's coming from. Or maybe from the window, maybe from the door, maybe from. You can actually predict where it's going to come from and how it's going to move, or who it's going to affect, whether the adults, whether the young, whether the old, who's going to come down with the most mortality.
Yeah.
That's what technology will help us to be able to do. You're able to also detect it easily, detect it quickly amidst the populace. You're able to also respond efficiently too, as well. And apart from that too, let's not also forget that technology would, in a great deal of way, help us to mitigate the social and economic effects of COVID itself. Right
Interesting
now,
to know how.
Yes. Thank you. We have the almighty internet that has made it possible for us to still have the social interactions that we used to have before COVID happened. If I wanted to probably see Loretta sometime, I'll have to probably get an Uber or find one Okada and then be in the road, be on the Okada, be in the sun for only God knows how many hours before we can just say, hello Loretta, how you doing? But we have the internet, right? And we could work from home, so we could be on Zoom and we could do all of that, or we could have on Microsoft Teams, or be on Webby, or be on any other virtual platform and still have the same social interactions that we used to have. That's what technology is doing. We could as well use the same technology to boost how we trade, so we don't have to say I want to go to the bank. Oh, let me just go and stand there and queue and then contact someone who was positive already and then get the virus as well. We have technology helping us to do our financial transactions easily from the comfort of our homes. I need to see a doctor. I don't have to go to the hospital. I don't have to go to the outpatient department. I can be at home, use the telehealth platform like my doctor or Medics to You, or even just call use the Helium Health mobile application and then still be able to see my doctor. That's one way technology is helping to mitigate the social and economic effects that COVID is causing to all of us. We could have education being done right there in the comfort of our rooms. We could have learning done there without having to go to school or any other thing like that. So many places where technology has been mitigating and will continue to mitigate. Think about this. There's this aspect with robotic 3D printing, where 3D printing was able to help print mechanical valves for ventilators.
Interesting.
When COVID started, we had just about, if I remember that value very well, we had just about 350 ventilators in the country. And then we are now in COVID season where everybody's looking for ventilators here and there, here and there, here and there, here and there. How do we get, how do we now bridge the gap between the buyer and the seller? Technology. Technology makes it possible for you to know, Loretta has about 20 ventilators in the house that she's not using. She's just holding them. Okay, let me contact her, give her more money, and then bring it to me.
Do you get? So everything is just falling into place.
Yes.
But with everything you've said, right, I think this is time for us to take each of the steps one after the other and then build.
Yeah.
Because if we want to prevent future outbreaks, I don't even think we have a plan or a system for mitigating spread.
Well, on paper we say we do, but
so that's the thing. Nothing on paper works. And recently, I've been so obsessed with data, and
it's a good obsession. It's a good one, believe me.
I've been so obsessed that I used. Work is always there, but my spare time, instead of me partying, I know people will argue because they think I'm always enjoying my life. But see, sometimes
but you are. We know.
No, not really. There's some days I'm trying to get work done, personally. Okay. So I started something with surveillance systems. So, as you said, you mentioned something around having, for example, people flying in from another country. Yeah. How do we even track that in Nigeria? I feel like everybody coming in or leaving Nigeria, we should have them in one place. Of course. No, electronically.
Yes.
And then I'm happy. I don't know if you know this, but Helium actually did something called the Helium Passport.
Oh, wow. Wow.
Yes.
Wow, I love this.
So it kind of it keeps tabs on everybody coming into Nigeria and leaving.
Wow.
Imagine if we didn't have this.
Sorry to cut you. That sounds like something. Wow. Last time I read something like that was something like that was also developed in Denmark, where something like a COVID passport also. I think that was done. But wow, Nigeria.
Oh yes. So yes, yeah.
Kudos to Go Candy guys.
Exactly. Wow. So. When you go on the site, you register. Nobody in Nigeria or in Lagos, because when we were even traveling, we had to use the portal to register and all, because it also helps you pay for your COVID test that you're getting done in the country. Wow. So very easy
Wow.
to use and beautiful. So I'm just saying that we need more systems like that
Yes,
at
yeah.
different points. So even everything has to go on tech, to be honest, in healthcare. And because healthcare is complex and we deal with a lot of partners, we need to look for a way to spread our wings. For example, in supermarkets, see how they've automated their everything
Stores, yeah.
on a system. They know what's in their inventory. Healthcare, some people still want to do paper and biro. And things cannot work
Oh,
like
my
that.
word.
And
Oh.
we don't even have standardized procedures. I feel like they are, but at every level, some people will want to cut
We
corners.
find it easy for us to bend the rules, or find it easy for us not to do, what will probably even bring ease to everyone.
Exactly. So we really need to start to dig and look into data, build systems, optimize technology. And, I feel like in future, because it's a very optimistic thing to say, we've dealt with COVID, never again are we going to ever experience?
Yeah.
It's not possible. Epidemics, endemics,
Of course.
pandemics.
Yeah. You heard that conspiracy about the 1919s, 2019s, 1819s. You had that conspiracy. Pandemics will always come. It now behoves on us as human beings, as stakeholders in the healthcare sector,
Exactly.
on how we must prepare. We have no other
Thank
alternative.
you.
It's
Thank
either we
you.
prepare or we just pack it up. I mean,
Very true.
it's important to the survival of our kind. We have to just prepare. And when we see technology as that thing that brings ease to just about everything, that thing that brings ease to just about everything, that's what technology is. If we're able to use technology becomes like the sidekick. That helps us to get the job done faster. Even though you're the superhero, you could weather the storm. You could probably just get some multivitamins, or probably just use some antibiotics. But when you put technology to it, helping you use data, everything becomes easier. Everything becomes faster.
And exactly.
Yeah.
I was about to say accelerated.
Yeah.
With technology, things are just boom,
Quick,
boom,
yes,
boom,
yes,
boom, boom.
yes.
So again, today has been insightful. Thank you so much for joining us, Dr. Akinwunmi.
The pleasure is mine, Loretta. It's been a wonderful time.
So
on
now
this
let's
segment.
go to where you hit that soup. I must cut it. Today is the day we cut the soup.
Oh, that soup, okay. that one that you are going to give me at the end of this segment. Sure, we should talk about it on air.
No, it's your own soup you want to cut.
Loretta, I know where you hide it to.
Please, I need to come back for Dr. Temidayo. We'll catch you guys in the next episode.
Thank you, Loretta.
Thank you so
Thanks,
much.
Helium Hell. This is the mothership for me now, Abby. Yeah, thanks for having me home again.
Soap, please, soap.